Thank you, Madam Chair, and I certainly appreciate the panel for being here today. You're all truly outstanding, and we have some Mississippians here. It takes a long time to get from Mississippi to here, but our folks that are interested in these healthcare issues traveled. I'm thrilled to have Ashley Parker here that has survived cancer. And Ashley, will you stand up too? She is just fiercely helping other people going through this, and I certainly appreciate her. What we're dealing with in Mississippi is the University of Mississippi Medical Center. We are working toward the National Cancer Institute designation. Our local legislature in Mississippi they have given $100 million to start this. We expect to break ground this fall in this. This is one of the most exciting things that we have going in Mississippi in healthcare. We've made a lot of progress in recruiting professionals, recruiting scientists, just the top there that are wanting to come help us. And we cannot be more excited about this for a cancer center and a research institute. But we know that attaining the NCI designation, although it's a top priority for me and obviously the legislature in Mississippi, we know that that can be a tall hill to climb. And Dr. Lute, I'm going to direct this to you and just ask about your commitment in maintaining open communication with the UMMC, the University Medical Center there in Jackson, and my staff during this process, including meeting with UMMC leadership to identify ways that we can support this very important project in Mississippi.
Senator, that is an extremely easy commitment to make. We very much like to hear from centers, especially in states that don't already have an NCI-designated cancer center. We'd love to hear from centers who want to take that next step into designation. I love what I'm hearing about. There's really three legs of this stool. There's institutional commitment, and there is infrastructure support. And I love what I'm hearing about what the state of Mississippi is doing towards that. The third leg of that stool is research. And it's very important, a very important part of the NCI designation is that there is a commitment to research. I actually am already familiar with some very high quality research at University of Mississippi. I've worked for a couple of years with Dr. Pier Paolo Claudio and his wife, who are doing excellent work in functional precision medicine there, and I look forward to continuing to help them. So I know that excellent research is taking place in Mississippi. It's very easy for me to say that with our Office of Cancer Centers, we very much look forward to working with the staff at University of Mississippi to make this a successful application.
Thank you very, very much for that encouraging answer, for sure. And and Dr. Lute, I also appreciate knowing that we have your support and commitment. And I'd like to follow up on some things that Senator Capito made comments about, addressed in her questions about the challenges some states face toward NCI designation. We both represent very rural states, and we have so many areas that just don't have access to good health care. And they're under-resourced states that they just don't have the same longstanding biomedical research infrastructure for various reasons, obviously, that, we're small areas, but the funding of those pipelines and institutional capacity of heavily funded states, yet our need is immense. That's where we find some of our sickest patients in these rural areas. And Dr. Bhattacharya, I would like for you to comment on this as well, about the commitment to supporting rural and historically under-resourced areas and academic medical centers pursuing the NCI designation and sustainable cancer research that we are certainly putting our best foot forward in Mississippi trying to address.
Senator, we are absolutely committed to that. Again, a very, very easy ask, as Dr. Latai said. There's at the NIH, we have many programs to make this happen. I'm looking for more. The IDEA program to make sure states like Mississippi and institutions in Mississippi have a chance to get NIH funding. The Care for Health program to make sure that patients in rural areas and other hard-to-reach places have access to the best clinical trials. We want to make sure that Americans, no matter where they are, benefit from the fruits of biomedical research, and scientists, no matter where they are, if their ideas are good, have a chance to get NIH funding.
Great. You all do an excellent job, and I'm so impressed with all of you and the things that are to come, and your interest and your commitment and your dedication, your motivation to address these is very, very applauding.